So we're so fortunate to have with us today Joao Monteiro, the editor-in-chief of Nature Medicine and a longtime colleague. Joao, thank you so much for taking the time with us today.
Thanks for having me.
Joao, I was wondering, since you are privileged to see some of the most interesting scientific work being done pretty much anywhere around the world, lots of it coming your way, could you share with us some of the more interesting things that we might not be able to read in your journal because it was whipped out or because it is something you read elsewhere? What can you share with us today?
Yeah, I think that's probably a very challenging question because there's just so much information coming out very quickly. I can tell you that some of the things that we are most excited about or that we would like to be hearing more about and understanding better is really, whether we can develop a protective immunity against the new coronavirus and how we can measure that type of immunity. This will be very important as we move forward with vaccine development and we understand what we have actually to be looking for in the people we are vaccinating in this first wave of trials as a measure of whether they will develop a protective immunity and what that type of immunity would look like. So I would say right now we're very interested and we're seeing a lot of new insights into the immune response against the coronavirus. Some, I would say, a little concerning new data suggesting that it is possible that for people who do not develop a very strong infection or develop an asymptomatic infection by the virus, that immunity might be short-lasting. But I think that we need more data in order to understand this problem better.
So you're standing as a journal really in the border between basic sciences and the practice of medicine, and you really have to choose where those two worlds come together. In view of the recent challenges, have you been considering perhaps because of this event having more papers on the practical side as compared to the past?
Yeah, definitely. I think we had to adapt our editorial criteria to cope with the needs of the pandemic. In the very beginning, we really didn't know anything about this new virus or what the disease looked like or how we should be responding from a public health perspective. So we did adapt our criteria to identify research that we felt was most urgent to be surfaced and to be vetted by specialists, and that needed to be made available to our readers in a peer-reviewed form very quickly. As the pandemic moves forward and we have more and more information coming out, of course, our criteria for what we consider, scientific, a new scientific development also changes. We move from just understanding the very basics to looking for work that's more robust, that is looking at larger populations of patients and how they respond to the virus or how the disease manifests in these people, how we can understand whether people will develop a very severe disease or not. So I think our editorial criteria, it significantly changed in order to be able to cope with the needs of the pandemic, and it's constantly evolving as we accumulate new knowledge.
Is there any specific type of domain that you would be most interested in the coming future to see more papers or suggested papers coming in your way?
Yeah, I mean, I think there's so many gaps still in our understanding of what's happening in this pandemic. We are, as a journal, very interested in some aspects of how you manage the pandemic from a public health perspective, of what kind of new technologies can help us to understand how the virus will spread, how you can predict ahead of time whether there will be new hotspots of viruses, how we can stop transmission chains. I think we are beginning to make movements towards that direction, but a lot more is still needed to be able to effectively control the virus.
I see. You know, I'm sure that this period has been challenging for you both on, you know, as usual, the personal, the management roles, and the all of the duties of the editorial in chief. And I was wondering, how did you cope with the deluge of incoming papers in a time when everything is so, you know, primordial, if you'd like, in the terms of the level of research, and in the same time, you have to try to control and prevent issues of both bad science and deliberate fraud, and we know these things happen. So do you have any new methodologies you've developed during this time to try to cope with this great strain?
I wish I had. I think, you know, the editorial process and the essence of the editorial process has not changed with the pandemic. Of course, we have developed, you know, a faster approach to it. In partnership with the scientific community and our reviewers who have been being fairly available to us to review papers much faster than they normally would do, with the understanding that it is of, you know, utmost importance for the entire world that data and vetted information is out there. I would say, you know, I don't think we have been taking corners or cuts in the process. The process is the same, but it has been optimized to eliminate any gaps or time sinks so that we can get information out to our readers and to the scientific community as quickly as possible. So I think we all are doing the best we can within the circumstances we are all in at the moment. You know, the pandemic has caused disruption at every single level. In editorial and publishing, that's no different. Our editors are also overloaded with work, and our colleagues also have their personal lives disrupted. So I think everyone is trying to do the best that they can within the circumstances. And, you know, in any evolving situation, there is always the potential to make mistakes. And as long as we can correct those mistakes, I think that is part of the process.
Thank you so much, Joao. That was very insightful, and I think it left us with some thoughts. And then someone who went through the process of the publishing cycle and knows both sides of that, I think that the work being done under such strain is only admirable. So I want to thank you and your staff and your team for the wonderful work that you've been doing day and night and weekends during this time to allow us to get the best science in real time. So thank you, and looking forward to the future and to some new insights coming in.
Thanks, Ron. My pleasure.
Thank you.